Medical professionals of ReadIT, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Artisanal_AF. There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. V_imaginary. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night, at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if Plan B will work. O.O. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me, no sir. There isn't anything you can take now. Gelatin. I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her. Which I tell her. She gets mad and starts screaming at me, won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless and idiot, you name it. Whatever, it's slow and these calls are usually good for a laugh. She takes a breath. I say, ma'am, I'm not sure who called you, especially since we haven't heard of you before now. She interrupts with, no, it was definitely you. You said your name was Gelatin and you were calling from Advanced Home Health. Ah, we have detected the problem. I tell her I see what's going on. You accidentally called Ambercare Home Health. Let me get you Advanced's number. Then she says I have it. They didn't pick up the phone, so I called you guys. I was not expecting that one. Bruno Gervais. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God Almighty. The report went back, patient provided improper specimen. Cretutu. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Hot cock. My brother shot himself with a ricochet hunting one morning before school. Dad had the doctor write that he was missing school and later PE due to gunshot wound to the leg in his note. That note is now framed and hanging in the living room. He's oddly proud of it. No clue why. Gun safety is a huge deal to him. We weren't even allowed to aim Nerf guns at people or pets. Dig big dandit. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an apical stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Very attractive. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault. Never saw him again. Schuflinger. Rural ER doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Thomas to handle. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away. And she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. NA Momps 3. Had an 18 or 19-year-old girl come in my ER with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, sperm travel. Monk Big T. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without formal warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. Classic_dust_8431. I am a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained, because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. Me, what brings you here today? P, Doc, my right hand fingernails keep getting yellow discolored. Me, only right hand? P, yes. And only after meals. Me, do you eat with your hands? P, yes, always. Me, so, you know it's just turmeric, right? P, yes, but can you make it stop happening? Me, for God's sake, use a spoon. P, so you mean there is no medicine to make it stop? Me. P. Me, no. This might hit home more with people of South Asian cultures or people who habitually eat turmeric-cooked food with their hands. Anyway, for a grown-ass person to complain of this was just well surprising and a little ridiculous. Dragonkin08. I work in veterinary medicine and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian. Their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for GI upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Ta-tink. EMS here. Had a diabetic in his 30-40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as HI, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his fore and play with the fore wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a Band-Aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. Have you some interesting story to share? Leave a comment while we continue. Kenobi_01. I have heard a story about a patient on whom it was impressed that she couldn't miss her fractions of radiotherapy if she was busy, and to inform us if she couldn't make the appointment. She couldn't make it. So she sent her twin sister to receive the radiation therapy in her place. She answered yes to all the ID questions, had the same birthday, etc. It was noticed when radiographers had trouble matching her to the CT, because the CT was of a person who had undergone a mastectomy, whilst the patient still had both breasts. This, many years later, is told to new staff during training about the importance of ensuring correct identification, because you would be stunned the number of people who try to skip the queue. The number isn't high, but it isn't zero. Chaplain Grill SGT. ER nurse with 7 years experience. The list is nearly endless. People with massive burns because they smoked in bed is not as rare as you'd think. But the one that got me the most was a guy who came in for chest pain and fatigue. EKG revealed he was having a really bad heart attack. Activated or cath lab for emergency stents to hopefully save the guy's life. They almost always access the patient through the groin for the procedure, so one of our jobs in the ER is to shave the patient's groin to prep them for cath lab. We get the clippers out, we don't use actual razors anymore, and informed the guy we needed to shave him. He refused. No problem, we will let cath lab do it once he's knocked out. Nope, guy refuses to sign the consent for the stents because he doesn't want his pubes shaved. After trying to educate him, pleading with him, and contacting every goddamn lawyer the hospital has, the guy signed himself out AMA and went home. He would rather die than have his curlies shaved. We looked up his address and we weren't the closest hospital, so if he died at home, medics would take him to a different hospital. Doubt he survived the day. The Agent Loki. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMS/fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Apprehensive Emu 570. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints and blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. The topiary. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy, wobbly reflexes, haziness, the works. Me, what happened? Patient, it's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue, so I used the same dye for both to match the color. Me, does that hair dye contain ammonia, by any chance? Patient, I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me, unless you can convince then to change the color scheme to red, no. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later came back for the referral. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily, no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large, red and white tent in the middle of the day, it was then that the elderly relative admitted to having spent the last 3 years driving from memory. Thank you for watching. Subscribe to not miss out.